I was sent a few website threads and statements where doctors from all over the world were anonymously spilling the beans on medical and health secrets that they don't want you to know. So in today's video, I thought we'd put these deep, dark doctor secrets to the test and figure out whether they are true or not. Fair warning, you may find out some things that the medical community have been trying to keep secret for a long time. But before we get into it, I am Dr. Jordan Wagner. I'm an emergency room doctor. I've created this video series to help answer some of your medical questions and the questions that I get from patients each and every day. If you find this video helpful, please do me a favor and subscribe. All right, let's dive right in. What I don't ever want you to know is that sometimes you or your parent or your child or your loved one would be better off dead. Okay, out of context, that sounds horrible. As an ER doctor, I deal with this in a different setting. So somebody comes in, they go into cardiac arrest, we get them back, and then they keep going into cardiac arrest. We get them the heart restarted because of the medications that we're giving, like epinephrine, and then a minute later, they can't sustain their own heartbeat and they die again, and we keep going back and forth. Then we have a conversation with the families or next of kin that this person is probably not going to survive this. Should we continue to do this versus should we withdraw care and let nature take its course? And most of the time, when you watch these events happen, you're doing CPR, cracking ribs, doing a lot of these brutal techniques to get the person right back where they were, most people say, please stop. That patient will pass away right then and there. And it's our job to present all of the medical information to the family, patient, everybody, so that there can be an educated decision. At the end of the day, what will the quality of life be for that individual? Oh yeah, remember that Seinfeld episode where Elaine tries to steal her chart because it says that she's difficult? Do doctors have that sort of thing? I work in the ER. Our charts are all electronic medical records that actually all patients have access to. There are things that pop up will tell us if somebody's been there 24 hours before, 48 hours before, 72 hours before. They'll also tell us if they're a frequent flyer, if they've been there multiple times. There are different codes that can be placed on the kind of the grease board, so to speak, in the emergency department, having to do with a psychiatric patient, a stroke patient. But sometimes it's actually valuable for the doctors. That way they know what they're walking into and not blindsided as well. Eat a goddamn apple every day. Okay. Abstractly, eating healthy, eating fruit will optimize your body potentially to stay away from the doctors. Now, you should have a doctor even if you're healthy in case you become ill with an infection or something like that. But there's so many diets out there. The biggest thing is not necessarily eating an apple a day, but don't eat crappy food. Fast food, fried food, all of these things are not good for you. We should be eating fresh produce, fresh vegetables, meats, fish, some breads, all of these different things. So yes, a healthy diet keeps a doctor away. Doctors are moody because they dislike the public. Doctors are human beings. You have no idea if literally I walked out of a room where somebody just died and I walked into another room where somebody's yelling at me for pain medications. Yes, it's potentially a consumer business in the sense of I'm providing a service, but I'm also do not need to be taken advantage of or abused verbally or physically. Many documented nurses and staff members are actually physically assaulted by patients so they can get their way. All of my colleagues, no matter what, try to put on the best happy face and clean slate every time they walk into a room to address a new person, a new patient. Medical textbooks are outdated. So by the time a textbook is actually published, yes, some of the things could be outdated. Sometimes the treatment modalities are more updated. You go through residency trainings, which then you learn all the updated information. Last year of your residency, you take your board certification, so you're taking a board exam. Now, it used to be that the board exam was recertified every 10 years to be up to date on information. Now they're actually changed it to where they actually do it every year. You're also required to hold your state medical license to do continuing medical education hours. Some states are up to 50 hours a year of extra medical education that you have to document and send in, that you're learning all the new updated information. Just because textbooks might be a little bit out of date, your doctor's not out of date. Doctors sometimes deal with substance abuse problems or even worse. Doctors are human beings, and there's always a part of a population of human beings that have to deal with substance abuse and depression, anxiety, physicians don't have any access to the medications, actually. The nurses do. And the only time I've actually ever handled drugs are depending on hospital policies. There are times when I do conscious sedation in the emergency department where I have to push the medications. Whatever is unused, I have to give it right back to the nurse so she can document everything. Most doctors don't want you to know that placebos work. What is a placebo? A placebo is believing that you're getting something that's going to work, or believing in something that will work, even though maybe it's just water. So it is against the law and illegal for me to pretend to give you something that I said I'm giving, and I can't document that I'm giving you anything that I'm not giving you. If I say everything is great, everything looks wonderful, and you feel perfectly fine, you will potentially feel that you're giving reassurance. But that's the extent of what I can do as a doc. But think about it. You have research studies out there. If somebody truly believes that the placebo is going to work, it does work a lot of the times. And how can you explain that? It's very hard to explain it, but it's the power of mind, body, and spirit in the sense of being able to heal itself and get back to homeostasis. They don't have time for you. I can only speak for myself. My job is to treat patients who come into the emergency department who are ill, but it's also my job to educate the patient. Teaching somebody what the medical problem is, what the medications are for, and why makes a huge difference. Is my time living in the emergency department? Yes. If somebody is in cardiac arrest and we're doing CPR, and then somebody's coming in because they have a laceration through their skin, unfortunately, the person with the lacerations get to wait because they will survive. If you wait on the person that doesn't have a heartbeat, they really won't have a heartbeat if you don't get to them fast enough. I think a lot of times people misunderstand the time that a doctor has. I wish I could have Heelys so I can just like fly around the ER. Doctors can tell you are lying. We're pretty good at it. This does happen often. We get all the time where patients are not upfront with us about their problem. It's our job just to treat your medical issues and make sure that you're okay. Can't tell you how many times I literally have to tell somebody, like, just talk to me. I just need to know what happened, what you're feeling, what's going on so I can treat you appropriately. If you don't tell me these things, we can actually go down the wrong road of treatment and therapies and actually cause more harm. If somebody overdosed on an opiate and they got woken up by Narcan, and they're like, I didn't do anything. It's like, well, no, you had an opiate because Narcan doesn't do anything other than reverse an opiate. So there are certain things where you're just like, what's the point of lying? And some people stick to their guns. Doctors pretend they're okay even when you are not. And I think that's just the technique of a specific doctor, not all doctors. Somebody comes in, we find a mass. If it is read or documented or shown that it could be potential, say, cancer, I'm going to discuss that with the patient. I'm going to discuss that it is potentially cancer, but we don't know definitively until we get more tests and more biopsies. I always then comfort the patients and rest assure the patients that we will do everything that we can, because a lot of times if you just give the news and then you ditch the patient, yes, that puts him in a bad situation. But if you tell the patient the bad news and then you say, hey, this is what we're going to do, it sets a plan in motion of future thinking and then positivity to get things going and done versus, oh, you have cancer. Okay, goodbye. Follow up with your doctor. That's not right. That puts patients in a situation where they feel alienated and they don't know what to do. I think doctors nowadays are pretty darn honest. You have to have some skill in delivering that honest news to somebody without being dreadful about it. These were really good. I think a lot of them, most people know. Some things are based on doctors as individuals, but these are really good. Throw in the comments any weird secrets or things that you've heard from other people about doctors, what we do or not do. If you guys like this video, you're gonna love this one. Check it out. Smash that subscribe button, turn your bell notifications on. Thank you so much for watching and stay healthy, my friends.